Hi everyone, this is Dr. Pepe here, and we are going to be discussing Domain 1, Professional Practice and Ethics, and we're going to be discussing Subgroup F, which is to discuss the limits of confidentiality. Again, in order to discuss the limits, first you have to know what is confidentiality. Confidentiality is sometimes referred to as counselor-client privilege, right? And what I mean by that is, um, in order for therapy to work and in order for the core conditions to be in place, that will allow for a trusting relationship to happen, then the client must feel like they can confide in the counselor in order for them to share their life story or their lived experiences. And again, part of that is going and explaining to the client in the intake what all that means and what all that looks like, right? And it's a process which kind of, as a counselor, you have to explain what that counseling process looks like, as well as some of the limitations. And again, you have to keep the environment into consideration. For example, if you're working in a school or you're working in a criminal justice setting, then you would expect, you know, limits to that confidentiality, and that has to be explained to the client as well. Um, Part of those limits is explaining to them that, some things that may be said may be looked at by other individuals, and that has limits. So, in the schools, because that's a population of minors, then obviously, what is said is very limited. And if parents request, or if they look for, what is being said, then as a school counselor, as a clinician working in the schools, there's definitely a limit to what can be discussed, and access to notes and medical records and things like that. So it's important, whether it's a minor or adult or a prisoner, to be informed. Also, to the famous Tarasov case in California, which the client said, I'm gonna go and kill this person, and kind of discussing if there's a threat of harm, whether it's homicide or just general harm, or if there's a threat of self harm, then again that is a limit to confidentiality, and that needs to be discussed at the beginning of the process, so that the client is very clear as far as they understand, what is discussed and what is not discussed outside of the counseling session. Also, if the counselor, for example, if it's a new counselor, if they are doing recordings, then they need to discuss limits to those recordings and the purpose of those recordings, as well as who is watching them, or who can even have access to them, right? So if there's a recording, and the student is a student of the university, who can have access to those recordings. That is a limit of confidentiality, and it should be very clear, both in the intake as well as in the written documents, what those limits to confidentiality are.